Sorry, we're a little bit delayed today. We had a few tech difficulties, that happens, but welcome to the COVID-19 CommunityResources.com town hall meeting powered by the Center for Closing the Health Gap. And I'm so excited whenever she's here, our special moderator, Tropicana from the Wiz, WIZF. And Tropicana, thank you for putting this town hall together. So
Thank you for.
Yes, we're just so excited. She pulled together some CPS parents and Shauna Murphy, who is our assistant superintendent, and we're gonna introduce everybody in just a second. First of all, we've got to give a shout out to our tech team because they work with us and make sure all of this goes smoothly. And those of us who are fumbling with the tech, they show us how to make it work. So we are really thankful to them. So that's John Reichel and Lauren Harden. And remotely today, Sloan Harris. So thank you, all three of you. Really appreciate it. Just to let everybody know, we do record these sessions, and that's so that we can broadcast them later. So you'll be able to find them, and people who missed this town hall live can find them on COVID-19communityresources.com, as well as other platforms. So I'm your co-moderator. I'm Cincinnati City Council member Jan Michelle Lemon Kearney, and our wonderful co-moderator Tropicana from the Wiz. Is Tropicana, wave to everybody. You all see Tropicana out there. We have two parents who are with us. We have Leah White and Leah, let me make sure I get the names right. Yes, Leah White. Leah's on there somewhere, and Joyce O'Farley. And
hey, how are you?
Great. And then we have our assistant superintendent for Cincinnati Public Schools, Shauna Murphy. So all of you,
everybody.
We are so glad you're here. Opening up schools is a huge topic. I want to tell all our listeners on Facebook Live or Zoom, you can start logging in your questions because by now, you know how this goes. We have our wonderful panelists who are going to ask and answer questions, but we want to see your questions and comments as well. So let me turn it over to Tropicana to make introductions for our panel. Tropicana, let me turn it over to you.
Good afternoon, Jan Michelle Lemon Kearney. I just love to say your name.
It's a lot of name, I know.
I love it though. Thank you again for hosting this and allowing us to have this platform or share this platform with you to talk to my listeners and the other parents, fellow parents. I'm learning a lot from my fellow parents online and just having these type of situations. So thank you. Unfortunately, Leah is not going to join us today. She had an emergency, so we are sending prayers up for her. She'll be fine. The other parent that we have on the line today is a person that I genuinely admire here in the city. Her name is Joyce O'Farley. She is I would like to reference her as a new mommy's guide. She's like a living, walking social media guide to new mommies, from everything to whatever Mike DeWine is talking about with COVID to Little League football. She is the person that I check her page every day to see what's going on with the kids and how to be a better mom. So I'm really glad to have her here with us and joining us today.
That is fantastic. Well, Joyce, we know you have a lot of comments and questions for us, as do our listeners, but let's just start, for those who missed the Cincinnati Public Schools meeting on Monday, we've been waiting for that September 14th date to find out what's going to happen. Are we going to be in person? Are we going to stay home? Are we going to do, part of it? So, Ms. Murphy, if you can go, is it all right to just go by first names today?
Absolutely. Please call me.
Okay. All right. All right, that's great. I love it. I love when people just call me Jan Michelle. When people call me Councilmember Kearney, I'm like, okay, that's too much. So, okay, so we'll just go by first names today. So, Shauna, if you could just go back and tell us about the decision that the Cincinnati Public Schools made for almost 40,000 children. It's a lot, big responsibility, how that was made and where we are now. Let's bring us up to speed.
Yeah, I appreciate this opportunity to be here on behalf of our superintendent, Laura Mitchell. Back at the start of August, the board came together with the leadership team and had a public conversation about how we would start the school year. And based on some data points in our city, we made the determination that we would start the school year in a distance model. So right now, all of our young people pre-K to 12 are learning from home. And the past 3 weeks, they have been working really, really hard. So we were going to have a discussion this past Monday about what we would do starting September the 28th. So the superintendent did share data points about what's happening in our city with the board, and they decided at that time we want a little more information based on Labor Day stats, what has been happening, because there was a concern that with the Labor Day activities and gatherings, that some of the rates, some of the data points may increase. And so we wanted to give it just a little bit more time. But also at that meeting, the board tasked the leadership team with talking about a second possible model. So while we were in distance learning, the plan had been to return possibly on the 28th in what we know as a 2-3 model, where our students would come to school split in 2 different groups. One week you would come 2 days, the next week you would come 3 days. But the board pushed back and asked us to look at what we're calling a 2-2-1 model, where again, we're in 2 groups of students. One week you would come Tuesday, Wednesday, and another group would come Thursday, Friday, with one of the days, let's just say it's Monday, being a distance day for all of the students. So this coming Monday, there's a called meeting, and it's at 5 o'clock Monday, and we will, the leadership team, be presenting the board and the public with an update on our data points, as well as the possibilities for this 2-2-1 model alongside the 2-3 model, should they decide that would be the better choice. And of course, they could also decide that we would remain in a distance format, depending on our data.
On the data, and they'll have that from Labor Day, just seeing how the numbers went.
Yeah.
Okay, so, and you all had a really long meeting on September 14th. Tropicana's going, oh yeah. So I think I hung in there for most of it, but there were a lot of comments. What was the general feeling? I mean, like, where is it coming out? Because
Yeah.
I heard people say we got to open. I heard people say, oh no, this is too dangerous. So where did all that come out?
Jan Michelle, you hit the nail on the head. That meeting started and lasted until about 10:57 is when I logged off. That was the end of the meeting. And we did have a hearing of the public, and there's a variety of feelings and opinions and desires and hopes. Some families, some teachers say, let's come back to school. Some families, some teachers, they say it's not safe yet. And the board, the leadership team, we want to make sure we do what is safe as the priority. So it's a mixed bag.
And I have to say, it seemed to me, and I wasn't really keeping track. I mean, I wasn't, in any kind of organized way, but it seemed like more parents with younger children were advocating to be back in school and, to be there in person, and maybe because they weren't sure. I don't know. I'm not sure why, but people had different things that they said. And I'm thinking maybe the parents of older kids weren't as pressed. I was going to ask Tropicana, because Tropicana has the cutest little boy. So, how are you feeling about it?
Me and Boogie have been in quarantine since March. Braylon, we talk about this often with COVID. My concerns with him is that he was premature and he has congenital heart disease. So as soon as COVID broke out, we went straight into quarantine, and he's not in CPS yet because he's in preschool, but he was going to school. And I've been homeschooling him this entire time, Monday through Friday. He has a desk that sits right next to my desk when I'm broadcasting live, and he's doing ABC Mouse and Circle Time while I'm, broadcasting live to the city.
I love
that. For me, it's been so much fun, because I want, one, as a mother, you don't get a chance to spend that kind of time with your kid because we are usually at work. So I didn't get a chance to have that experience to really understand his learning language. Now I know my son's learning language. He needs to be challenged. I got to tell him, you're not good at that. So he can be like, yes, I am. Watch this. And he executes it perfect. So I get a chance to learn him. However, March to September is a long time to be in quarantine, working full time from home and homeschooling and working at the same time as a mother. That's a lot. So I was nervous about sending him back to school, but Braylon's going to school in October. He's going back to preschool, and I need him to because he's missing that interaction from his peers. He hasn't seen his kid. He hasn't seen them. The preschool he goes to has a lot of things in place. It made me have questions for you all. I had to ask, well, we're doing a 2-1 situation or a 2-3 situation. Do the teachers switch out, or are we exposing the teachers? What are the safety precautions that we putting in place for kids?
Yeah, that's a fantastic question. That's a part of also making sure Cincinnati Public Schools is ready to receive our young people. So we do have several safety measures that we are following the guidelines of not only the CDC, but CPS, focusing in on what education looks like. So children will come to the buildings and have their temperatures taken. Teachers and the children, the whole faculty and staff will have their temperatures taken on a daily basis. We are asking faculty members and students, if you are not feeling well, to stay home. You know, usually we push through. We push through and we do what we have to do. We might think we have a slight cough or a little bit of a runny nose, but we push through and we come to work. But this year in this pandemic, we're asking people, no, we're going to stay home at this point. And so we have deep cleaning going on every single day. That game has been stepped up quite a bit. And we feel like we're just about ready to receive the children, but we would not do it if we didn't feel like we could do it safely. But yeah, to your question about the teachers, it is the same teachers. The classes are split, but the teacher is the teacher, yeah.
So the teacher with this new plan that might happen would be there 4 days.
Correct. Yeah.
4 days.
Okay. 4 or 5. So they may
okay.
do. So for example, right now in this distance format, the teachers are in the building. So if the board goes to a 2-2-1 model where one day is distance, I cannot say if they would determine teachers in the building or not at this point.
Oh, I see.
But right now they are.
They're working from the building, even though the students are at home. Okay. All right, Joyce, let's bring you into this conversation. Tell us about your children.
Okay, so I have a high schooler and I have an elementary. The high school student is more independent, more tech savvy with the computers, more, you know, informed about it. As far as my second grader, it was a very, very difficult transition because computers wasn't like implemented into curriculum last year. So for this to happen, I would hope and pray that if they did go back to in-learning school, that they will implement the computers more, just in case this ever happened again. Far as being a working mother, I'm not a working mother, I'm an at-home mom, but I do have to go to like doctor's appointments and treatments. So it has been very.
Joyce, let me just say, being at home means working too. So
Yes, it is a job.
Mom. You're a working mom if you're at home.
Yes,
I didn't mean to interrupt. I just had to let you know. We appreciate you. Go ahead.
Thank you so much. But I do still have, you know, a life. We all still have lives outside of still trying to be assistant teachers, because I call us assistant teachers now. That's because right. We're not teachers, we're still assistant, right. You know, and this was very hard for all of us, not just, you know, for the teachers, but for the parents as well, including the students, because we have parents at home that's frustrated. Some parents need downtime, that the time that their child was at school, they had to like get mentally, you know, just a little mental break. Right. So now that we got our kids 24/7, it's like, and you got to pray for the kids that's at home, but we don't even know if kids are getting abused at home, you know, now. Like, it's a lot to think about. Right. So if we do go back to school, I just hope that they continue with the computers in school. So if this ever happens again, they won't just be all over the place.
Right. And I know, Shauna, you were talking about the internet and some of those challenges before we got started. You know, what Joyce was saying about the computers is really, you know, just brings up that topic. Let me throw it to you to talk about that.
muted. When we left school in March, we thought we might be gone 3 weeks. There were gonna be 2 weeks. We'd have a week of spring break, and we had no idea that this would last as long as it has. I don't think anyone had that idea. And so, as far as even the technology and what classrooms looked like and what this virtual teaching looked like, it was all new to us. And so, we have learned very quickly how to beef up our teaching remotely with professional development we provided our teachers with. In addition to that, we are working really hard to make sure all of our families have the access they need by providing a device to every student in our school district. And then also working with them, partnering with them to make sure they have the connectivity that they need. So we have a wonderful partnership with Cincinnati Bell, but through that partnership, we have learned that there are some gaps in the broadband capabilities. And so we're asking families to reach out to us as best as possible to let us know how we can assist with making sure their children get connected. We are partnering with the YMCA, Cincinnati Recreation Commission, Boys and Girls Club. They are receiving our families because I do want to honor parents like Joyce, who they have worked so hard to take on this assistant teaching responsibility, and we deeply appreciate it, because without that type of attitude, I'm not sure where our young people would be. And so we're appreciative of our parents, and we're appreciative of those partners the parents who have to go to work, they're allowing them to come to their facilities to be supervised and to be assisted with their education.
Yeah, I was going to say, and you were talking about the partnership with CPS and Cincinnati Bell, and also Children's Hospital was part of that mix too, that they made a commitment to make sure that every household where there's a CPS student, I think it might be first grade or second grade up through 12th grade, to make sure that they not only have a computer, but they have free internet access, free if they need it free, but that they have internet access. And
That's
so,
awesome.
and we didn't know that back in March. I mean, that wasn't happening in March. So you all did a lot of hustling really over the summer to get computers out. I heard thousands and thousands. One day someone said, yeah, they gave away 7,000 computers to students last week. I mean, that was a huge undertaking.
Yes, absolutely. I appreciate that. Our IT department, led by Jeremy Gallagher, have really pivoted very quickly in the partnership with Cincinnati Bell to make this happen. We would meet, the leadership team, we were meeting every day from the time that we've been away from school, trying to problem solve and get ahead of this. I don't think that really ever happened, but we gave it 110%. And without someone like Cincinnati Bell stepping up to the plate to say, hey, we want to assist in this, I'm not sure what many of our families would have done. So every student has a device, has access to a device that they have at home in order to do their studies. And we want it to be every individual student and not family, because there are materials loaded on those devices that are specific to each child and each child's grade level, as well as the content they need depending on where they are. So for example, Joyce's second grader and high school students should have separate devices.
Oh, okay. Okay, that sounds great. Now, another topic that Joyce brought up, and this is something I think we haven't talked about that much, but what about children who are at home who might be victims of abuse? Because it was different when they were coming to school and their teachers could check them and say, wow, that bruise is, I mean, they could kind of look at them and make sure they were okay. But what about that? What's in place, if anything?
Yeah, absolutely. So, as school personnel, we're mandated reporters, and so we constantly worry about our kids when they're away from us. We do have a system set up where each school has a team, and they are reaching out to the students and checking in with the students on a daily basis. Also, all of our schools have mental health partners in the building, so they know the students know them, they're comfortable reaching out to one another. And so we would not let this time go without checking in on our students as much as possible. And if someone has some information that, you know, we should be made aware of, or JFS or those like JFS need to be aware of, we would love to be a conduit for making sure that that happens so that all of our children are safe. We also, again, understand the number of parents who have to work. And so they may be a little intimidated. Maybe their child is just a little too young to be at home. Again, there are partners who are receiving young people in their facilities for supervision while you have to go to work.
Okay. And you know, another thing that keeps coming up in these conversations is, you know, one, you know, we're waiting for the actual plan, and that's going to happen next week, right? Yeah. But we also hear that November, January, there's a possibility that even if we're back in person in October, things might get bad. I'm not sure why. Maybe because it's going to get cold and people are inside. Can you tell us a little bit about that, and, you know, what's in store? What are we planning for?
Right. I think people are a little concerned about what would be traditional flu season, and if that would have an impact on the numbers of COVID cases, people becoming sick or having to be hospitalized might rise. And so what we have said to the board and to the public is we'll be ready to pivot with whatever needs to be done. So if we feel it's safe enough for the young people to come to school, we're ready and excited to receive them. If the decision is made either now or in November, December to get through the flu season, that we need to remain in distance learning, we will put everything in place to support families and young people as much as possible. So we're ready, whatever the data of this city says they need us to do as a school district serving the students in this district, we're going to be ready.
And you know, that's a different feel than we had in March. I mean, yes. I get the sense from you now that, you know, whatever comes at us, we can handle. You know, we've got the internet going, we've got the computers going, we know how to do this from home. I know as Tropicana was saying, you know, parents are like, okay, well, you know, maybe it's time to go back. But even if that can't happen safely, it sounds like, I mean, this is just a different feel than we had in March when I think everybody was just panicking.
Yeah, we have wonderful principals in our buildings and amazing teachers. Each school in our district has an instructional team and an operational team. This time last year, we didn't have operational teams. You know, how will this work? How will we keep social distance with the young people? How will we make sure that they keep their mask on so that they're safe and others around them are safe? We didn't think about the signage that we need. We didn't think about the thermometers that we had to buy. I mean, this COVID situation, it's a whole new budget line item in our budget that we definitely had to address. That this time a year ago, starting school, it was absolutely not on our radar. Now we are so much more health conscious in our schools and with our staff that it's a big change in our philosophy of doing business.
Wow. Okay, well, let me bring Joyce back in because I know Joyce had some questions as a parent. So Joyce, what do parents want to know?
Okay, so one thing for the elementary kids, how do they plan to have the kids keep the mask on, especially the little boys?
Yeah. That's a great question. So my granddaughter is a kindergartner, and I remember being very, very concerned about that. So what we've had going on is very interesting. I'm thinking about a group of young people. We have daytime tutoring happening in a couple of our locations for the children of some of our employees. We offered that as a service because they're working parents and they have school-age children. And so our superintendent decided that we would provide this particular service to them. The kids have been amazing. They have been amazing with the social distancing, keeping their mask on. And I think it's like, you know, sometimes they say learning a foreign language is so much easier when you're young. Because as we are older, we are set in our ways and we like to do things. And I think that the kids have enjoyed not enjoyed, but they've adapted well to wearing the mask. And so we'll just stay on top of it. We've not seen, obviously a school full of young people that we're trying to get them to keep their mask on, but we're fully aware of how important and critically important it will be to do that, to keep everybody safe. So we're working on it. We'll see when they return.
Yeah, I'm thinking a bigger challenge might be those high school kids, because they probably think they're just invincible. I know my son does, like, hey, he's 16.
Yeah.
But they need to be careful too.
So our board
Michelle, I have a question.
I'm sorry.
Oh, I'm sorry.
Go ahead.
I didn't mean to interrupt you. I do have a question. One that I saw on Facebook that I was wondering if you could speak to. I know that you said that parents have internet access with Cincinnati Bell. I was on one of the Facebook pages and I noticed a parent who said that she had a past due bill with Cincinnati Bell and she wasn't sure if she could still get internet access for her child. Can you speak to that at all?
Yes. So absolutely, a past due bill will not prevent a family from receiving this service from Cincinnati Bell. So that did come up when we began this partnership. We kind of heard that a little bit from families. And actually there were, I believe, some employees of Cincinnati Bell sharing that information, is my understanding. But since then, again, this is all new. I believe that's all been cleared up, and having a past due bill will not prevent you from taking advantage of this service.
Oh, that's
So
awesome.
please encourage them to call.
Another question that I saw parents talking about, it was a gentleman and it was funny. He said that the math that his child was taking, he was not, current with it. He didn't understand how to do it. Math has changed since we've been to school, and he didn't know, how to help her. And the things that he was teaching her was different than what the teachers were teaching him. So is there a resource that parents can use to kind of keep their kids current with what they are learning in school?
Dr. Ken, I'm so glad you asked me that question. This is another brand new piece. So we are launching what we're calling Study Hall. Study Hall is a virtual homework help session. Okay. And I'm going to, can I share all you have to do is register at studyhall.org, studyhall.org, and the registration is open. This will provide one-to-one homework assistance and provide study tips for young people. And this is for grades K to 12. The emphasis is math and literacy, but you might run into a tutor who can do a little biology if that's necessary. But it's simply studyhall.org. It has just started. This is a brand new opportunity for young people. I wish I could demonstrate it for you because it's absolutely wonderful. You can set it up so that either you can have a conversation with the tutor or you can simply chat with the tutor, whatever your comfort level is. And these are all tutors who have done background checks and will be fine to work with young people. So studyhall.org.
Okay. Awesome. I'm excited about that. Oh, Tropicana, I'm glad you asked that question because that is what parents are saying, like we're sitting at home here doing with, I don't know, some kind of calculus and AP stats. And I'm like, what? Like I don't remember calculus and I never had AP stats. So I'm just, I'm at a loss. So the fact that you have studyhall.org. So, and it's free.
It's free. So it's absolutely free.
Okay. Mm-hmm. Yeah. All right. That's fantastic. That is great. Okay, Joyce, we're back to you. Joyce
okay,
is exercise.
I'm at the outlet. Okay, so another question I have is, in the event a child does catch COVID that is in a classroom, will they quarantine the class for 14 days or would they do the whole school? Like, that's my biggest fear is if they go back to school and a child or a few kids catch COVID, would they have to quarantine for 14 days and then have to convert back over to virtual learning?
My fears too.
Yeah, fantastic question. So one, you may be familiar that Governor DeWine is mandating that all schools report confirmed cases, and there is a statewide dashboard. So we have already been charged to make sure we share out the data. If you listen to this past Monday's board meeting, we did share out the number of cases we had for students, as well as the number of cases we had, confirmed cases for our staff. I think it was a very low percentage, but I don't want to misquote. So we are charged with making sure we track and report that to you regularly, first of all. Second of all, it won't necessarily be that the whole school has to shut down. There is a protocol in place. We have a reporting structure. I understand that in the city of Cincinnati, the test results are coming back in about a 2-day turnaround. Mine took a little longer than that when I did it, but that was maybe at the beginning of August. But I do understand it's a quick turnaround. It does not necessarily mean that the whole school will shut down, but we may have to take a look at that classroom and deep cleaning those individual classrooms.
Yeah, that's good to know. Tropicana, go ahead. I'm sorry.
I keep stepping on you. I'm sorry, Jamisha.
No, you're good.
I guess my question is for parents like myself or that are concerned parents like Joyce. If I decide that, you know what, I send him to school, I'm too nervous with him going back to school, will I have an option to still do at-home learning if that's what I feel my preference is, or if my child has a medical issue?
Yeah, so that's a great question. So we have always had a virtual high school where kids came in person and learned through technology, right? But we also, and I think a lot of people were not aware of this, we also have Cincinnati Digital Academy. So Cincinnati Digital Academy is where the students stay at home and they learn via the technology, but they're at home and not reporting to a physical building. So that is the current option that we have in Cincinnati Public Schools. I believe we have about 1,000 families who have signed up currently to take that option in terms of new families to Cincinnati Digital. And so we have increased the teaching staff with that school. That principal, Eric Rozier, is doing a great job. You can imagine how many phone calls he's had and received and had to respond to. So there is currently that option, Cincinnati Digital Academy, for grades K through 12. The other question, and it's mostly a high school question, families want to know, are they able to return to their home school? Will they have their spot when the pandemic is over? And the answer is yes.
So will they, just following up on that, do they get to choose when they come back? I mean, for example, they might say, you know, it's January now, it's time for my child to go back to, you know, Withrow, Walnut, you know, wherever, or do they have to wait until next year?
No, ma'am. So we are hoping that they would at least consider doing this on a semester basis. So ending December, going back in January would work, because we then become concerned about grades and transition and closing out with a teacher, that kind of thing is really something that would be more beneficial for the student. So if we get to January and they decide they want to pivot back to their home school, that's acceptable.
So that's really good option. So for parents, and I'm thinking back to the September 14th meeting, for parents who are saying, even if CPS decides it's time for in-person, I might not think that's the best option for my child, especially if my child has pre-existing conditions. So I can still choose, we can still choose to do from home through the digital academy.
That's right.
And then maybe next semester say, okay, you know, the vaccine is out. Yay, let's hope everybody's fine. We'll go back. Okay, that's right. Really good to know.
Mm-hmm.
Let me ask you about, because we keep hearing about so many thousands of children, and you might know the number, I've heard different numbers, who haven't, signed in or tuned in, or they haven't, logged in. We don't know if they're connected or not. What about those children?
We are estimating that number may be somewhere between 3,000 and 5,000 children.
That's a lot. Yeah.
And that is why we put in place, each school team has a group of people who are reaching out to those families. Sometimes we have not good numbers, the numbers have changed. And so we also have school social workers and members of the school teams who are actually going out into the neighborhood, knocking on the door, not to be disruptive, but to talk with the families about how to get the child back in school. Maybe the parent just simply doesn't know Some people, have always waited till after Labor Day. That's a long-standing habit that people have, even though we've been starting school in August. So yeah, we are actively looking for a pretty large number of young people.
What happens to those students if they don't log in?
So yeah, we eventually, some of them we learn have decided to transfer. Either they've moved out of district, maybe they've decided to go to a charter school or a parochial school. Some families for now might be choosing that because they want that face-to-face learning. Many of the parochial schools and the charter schools are doing face-to-face learning. I'm not here to promote that, but that is what's happening. And so as we reach the families, this is what we're learning in some cases. But even aside from that, there are still families that we are still trying our hardest to reach. So everybody, please spread the word. The school is in session. Please call your school or the district 363-0000 and let us help you get your child enrolled.
Wait, the number is 363-0000? Okay,
Yes,
that's easy. All right.
Yes,
So,
there you
so
go.
people can call that number 363-0000, whether your child is still enrolled in CPS or not, and just let the schools know, we've enrolled somewhere else, or okay, we're ready to come back, because we need to know where those children are. When you say 3,000 to 5,000 children, that's a lot.
Yeah, and we need to know because one, we want you to stay, we want you to be a part of our school district, we want you to hang in there. But if as a parent, your choice has been to do something else, then that school needs to receive your child's records. And right now we still have them. So please, 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 we got to get our babies enrolled.
That's right. Get our babies enrolled, and we want to make sure they're doing some kind of school, whether it's Zoom or something. So that's important.
Exactly.
Okay, Joyce, back to you. Our
Okay,
parent representative.
spin off to the enrollment, the kids that's still not logged in. Is it not like anything like, when I was growing up, it was truancy where they were knocking on doors.
Right.
That's not in place anymore.
Yeah, our school social workers are going out knocking on doors. Many of our school teams have individuals, whether it's a security assistant, a school resource coordinator, they do have teams of people going out and knocking on doors. The issue is many times phone numbers have changed. Many times people have moved and not shared their new address with us. Things happen. Life, Joyce, life happens. But we are ready to receive them. I think some families may be waiting for this to be over. But we need them to know that we're in session. We are having school. This week is midterm week of first quarter, as a matter of fact. So we need the kids in school.
Okay.
Is there an option for preschoolers, or are they have to go to school?
Say it one more time, Tropicana.
Is there a digital option or at-home learning option for your preschool students as well?
I don't think Cincinnati Digital takes preschool students. I don't think.
Okay.
I can't. Let me get back with you on that, but I don't think there's a preschool Cincinnati Digital class.
Tropicana is still thinking now, what can I do?
Or what can I do? I need some help. No.
Well, let me share this too, Tropicana. The other thing last week that the board asked us to look at, should they determine that we're going to come back on the 28th, they have also asked us to look at a staggered start. So starting with the preschoolers, so the preschoolers on the 28th, and then adding grade levels as we go. So in the elementary buildings would be the preschoolers, start with them. And in the high school buildings, for the most part, they're 7 through 12 for the most part, starting with the 7th and 8th graders, and we're working through what that might look like. So your baby could have a spot on the 28th, maybe.
Okay.
And I also hear that it's going to look different, that like, for example, lunch will be in the classroom. There won't be all the kids in the cafeterias, all that. I mean, everything is just different. It's going to be different, right?
Yes. One of the things from the very beginning the board has said is we want 6 feet apart. And so that is why we have the 2 different groups, because we have so many children that we can't do 6 feet apart in our schools if all of the children come at the same time. So that's the reason for the 2 different groups. But yes, another precaution is we will be having lunch in the classrooms, and there are some measures in place for the kids to be able to remove their mask while they're eating, clean up their spaces, and then return the mask and go back to instruction. So yeah, it will be very, very different. I
I
don't know
think
if
you
you've
all have
ever.
done everything. So I didn't mean to cut you off. It just seems like you guys, I mean, I can just see how much planning and work has happened. I mean, it's wonderful.
We actually had Cincinnati Children's Hospital walk our buildings with us to point out things, have us consider things. You know, we put our measures in place and we said, you know, our floors are marked, the hand sanitizer is there, we've got our thermometer stations. And so they came out to the schools, walked the buildings with us to say, hey, have you considered? And so we learned very, very quickly how to be a lot more COVID ready.
Man, you know, so you know, here's another thing, because you know, in the summer there's that summer slide. No matter, you know, I mean, all before COVID, kids were out of school for 3 months, you know, which is great, you know, having fun, maybe doing some academic things, but there was always that summer slide, you know, that we heard about. So when they came back, when school started, they were a little bit behind where they ended up. Now with this huge gap, what's the, you know, what can people do? What can the community do to help? I know different people are saying they'd love to volunteer to tutor. You know, what's the plan to help our children catch up? Because I think we just have to accept during this pandemic, they're going to get, you know, they have gotten behind and there's just nothing we can do about that.
Right.
Yeah, and so, you know, I mentioned to you that studyhall.org. So if
Right.
you'd like to volunteer to be a virtual tutor, please reach out to me and I can get you connected on that right away. It's a simple background check that you would be responsible for, but that would be an amazing way to help. Other people are doing things like the Cincinnati Museum Center. They are still available. The outdoor people are interested and willing to come out to our schools. We are still community learning centers. We do still have resource coordinators who are bringing partners in and bringing resources into the buildings to share with the children and the family. So if you have an idea, please feel free to reach out to me. I would love to have a conversation with you. But if you're interested in tutoring, studyhall.org.
Okay, that's a great opportunity. Tropicana, I didn't know if you were interested in this, but at one point, Michelle Obama was reading stories to young children, preschoolers, and early on. I think it was every day at noon. I don't know if that's still going on. Is that still happening?
I don't know if she's still doing that, but I know that if she's not here in Cincinnati, I'd love to fill in the gap and do that virtually for kids who are at home. If I couldn't get to the school, that would be something I would love to do.
Oh, that would be wonderful. We have to make that happen
We have
because for
after story time at home anyway with Boogie. We would
right,
love to do that.
that would be so great. Yeah, you could be our Michelle Obama. So
There you
you
go.
could, yeah, you can read to our kids, because I think one, it gives parents a break, but you know, to read to children is so important for their learning. And so that's something, I mean, I think that would be a really great service. We will have to make that happen.
Let's
That would
set it
be,
up. Let's get it done. Whatever I need to do to get it done, Ms. Murphy, you let me know. And Jan Michelle, you put it in play. I got
okay.
it.
All right, let's do
Love
it.
it. Love it. Absolutely love it.
Okay, Joyce, how are you doing over there? Now you're in the car, you finished shopping, you finished walking the outlet mall.
Yes.
We're just following you on this journey. This is like, what are you doing now? Okay. All right.
So
So,
another question I have, the thermometers. Okay, so just a short story. I was diagnosed with COVID in June. My son actually quarantined with us, my 7-year-old son. He did not have one sign, one symptom the whole time. So I'm pretty sure he's
Oh, that's a good question.
asymptomatic. So with the thermometer, like I understand like the number one sign, but with the kids that's asymptomatic, it's scary. That's the scariest part about the kids going back to school. It's very scary.
Because you
so
don't know if they've been exposed, they might not have symptoms, but I mean, like I was also diagnosed with COVID too back in August, in early August.
Mhm.
Yeah, and so that I mean, you don't know if people around you, if they don't have symptoms, they still might have it, unless they've been tested.
Exactly.
Yeah,
And then the kids go home to their great grandparents. So it's just, that's my biggest thing. Like, and then another question with the vaccine, are they thinking about making it mandatory for the students to take it to go back to in learning?
well, let's take one question at a time. Okay, let's
Okay.
talk about what happens when the children are asymptomatic. And I just want to say too that you know, we were kind of laughing about this. I think this is a program Tropicana and I did before too, that you know, in the past when your kid had, you know, was like a little bit sick, you're like, here's some Tylenol, you get to school. And now we're thinking, wow, that probably wasn't such a good idea, because you know, you're exposing the teachers, and the teachers would say, you know, these kids come to school with these runny noses and they're hugging us, you know, which the teachers love, but then they end up getting sick. But now with COVID, you have
Right.
to think twice. You can't just say, you know, like, no, you need to be in school. Just, you know, suck it up and get out there. It's like,
And
yeah,
Michelle, the parents are not that responsible themselves. We just saw that over the holidays. And Joyce, you can speak to that as well. We literally just saw, I know that you've seen it the way I saw it. I saw a parent on Facebook Labor Day weekend. There
Mhm.
was a party at, I want to call it King, was that, wherever the party was. She said, I quarantined for 10 of my 14 days. I'm good. I'm going to the party. I can't miss it. So if the young parents are not that responsible, for a parent like myself, for a parent like Joyce, if you will put yourself at risk, it's fearful for me to send my child to school, because I don't know how you're raising your baby at your house.
yeah.
That's a scary
Shauna,
thing.
yeah, Shauna, what about that?
These are all great points, and medically, I can't really respond well. I can tell you this. Our district has required all of our employees to test before they come to work. And we've also strongly requested our partners who are co-located in our buildings to do the same thing. We've talked with our executive directors, and I can't tell you one who was not on board in agreement with that. We are not testing the kids right now, to your point, Joyce. And so we are just hopeful that the parents will really think hard and do the right thing, not only for their child, but for other children. And I know you want to hear more than hope, but medically, I'm not really prepared to speak to that and parent and choices of our parents. I think the more education we have out there about this, that this is real, the better off we'll be. And I also feel like keeping the kids socially distant in our schoolhouses and wearing the mask, even if they are asymptomatic, is going to help to continue to slow the spread, which is why our board has said only 6 feet. Some schools have returned and their kids are at 3 feet because they pretty much returned, not in our district, in other districts, because they are 3 feet apart, they feel like that's okay. But we're following what the CDC has recommended, and that is 6 feet and wearing masks, washing hands to slow the spread.
Okay. You know what? So there's Carol Patton has a question on Facebook. So let me, and Joyce, we're not forgetting about your vaccine question. Let's just go to Carol for a minute. And so she said, oh, well, her question, let's see, it was about busing. Wait a minute. Oh, she said, how will busing and the after school programs be handled?
Okay, busing, we're just doing one child per seat unless it's a family, unless it's siblings, but one child per seat assigned seating, which is different. You know, we used to have kids sit 2 and 3 students to a seat. So we're able to do that because of splitting the kids in half. And so there are fewer students in school, therefore fewer students riding the bus. After school programming is the same way. They also are required to follow the CDC Cincinnati Public School guidelines. They will be allowed to have a limited number of students participating, maintaining social distancing, wearing their mask, even in the after school programming.
Yeah, and so, you know, the thing about the busing is kind of concerning. I know we've had folks who are I'm not sure what they're called, but they assist on the bus, like they help the children get on the bus in the morning and I guess meet them in the afternoon. And they were saying that, there's no testing that happens. Like, if, you can just get exposed because whatever testing would happen wouldn't happen until the children get to school. So again, we have to put the responsibility, I think in that case, on the parents, that if your child is sick, we can't do anything if they're asymptomatic. I mean, the parent just wouldn't know. But if your child is, is showing signs, we want to make sure that we don't send them to the bus and to school, right? I mean, we just have to be really careful about that. So here's a teacher who's making a comment, and this is Dr. Sherry Adams Davis. She says, unfortunately, parents are not that responsible. Well, let's say some parents. She said, I've been teaching face-to-face for 4 weeks now. As a parent, I don't need a teacher to tell me if my child entered a building with a bad cold. I see my child prior to them entering the building. Should there be concerns for the teaching staff? And then she said, I hear people focusing on the children, but not a lot of mention about the teachers. And I think a lot of teachers, teachers love their kids, they love their students. But I think a lot of them are feeling that we're not looking enough at their health concerns.
Yeah. Well, so we are asking for temperature checks for the adults who come in the buildings as well. Even at the education center, we check temperatures every single day. We wear masks at the education center, and the expectation is teachers and staff in our buildings will also wear their masks, maintain the 6 feet of social distancing, and follow those same protocols.
And I like what you were emphasizing, the things we've been hearing all along: wear masks, wash your hands a lot, and social distance. And as someone who got COVID, but my husband was negative, my 2 interns who were with me all day in the office, the day before, I started showing symptoms, they tested negative too. And I think a big part of that is because we were wearing masks. I mean, we weren't necessarily 6 feet apart all the time because my office at City Hall is really small, but we tried not to be too close to each other, but everybody wore a mask all the time. And so I was really relieved that my interns tested negative, even though they were around me and I ended up being positive. So yeah, that really makes a difference. So I'm thinking, Joyce, your turn. Ask about the vaccine. And I cut you off mid question because I wanted to get to your first question.
Okay, the vaccine. Are we going to make it mandatory for the kids to take it? Because I know the flu vaccine isn't mandatory, but are they going to implement that?
Can I speak to the vaccine?
Oh, no, this is Renee Mahaffey Harris, President and CEO of the Center for Closing the Health Gap. Hey, Renee, welcome.
Hello, everybody. Technology gets me all crazy, so I apologize for all our tech issues, but listen, I wanted to respond.
So Renee, you're kind of breaking up.
Question about the vaccine on some of the experts, some physicians and others to speak to the vaccine, and potentially maybe someone who's from the actual principal investigation locally. So I think that there are a lot of questions that physicians are asking. There are a lot of questions that researchers are asking across the country from the National Medical Association, Cincinnati Medical Association, of educating our community about the importance of the trial. Get to where you are, Joyce, and your question that there needs to be.
You know what? Renee is actually in the same space that I'm in. I'm going to ask her to come to my room. Can you come in here, Renee, please? Because you were just breaking up. I'll just move over and give you. No, you have to come on in here.
Now.
No, I think you're really just breaking up.
Can you hear me now?
We can hear you now.
Yeah.
Okay.
My volume.
Renee, you might have to stop over.
My volume is down on my computer. I apologize.
Okay.
Can you hear me okay?
Yep.
Yeah. No. No, we can't hear you, Renee. You might have to step over with Jan Michelle, Renee. I think it's not necessarily about
Okay.
it's a service issue. You're breaking up.
So what I was saying is that
Okay.
Okay, here she is. All right, I'm gonna share this space with you. You come on right here. Here, you sit right here. Okay, here we go, folks. Here's Renee. Have a seat right there.
all right, sorry. All right, let me try this again. Technology works great when it works. So we are going to have a town hall dedicated to the conversation on vaccines. And I, again, don't feel that I personally want to respond to that question because there are a lot of national questions about from physicians, from Black physicians and other minority physicians about, you know, how to best really approach this conversation about clinical trials for our populations who historically have not participated in clinical trials. But in the case of COVID, we need to because of the disproportionate impact to us. So please plan to tune in with us on October 10th. What we want to do is launch a broader scale educational campaign about the trial with whomever is disseminating the trial. As you know, everyone is working fast, 3 organizations across the country to finish a vaccine and complete a trial in the research process of before the trial is actually implemented. So there's a lot of work to be done in educating our community so that we're informed before we make decisions. However, it is important that we are participating in the trial, but there's still a number of questions that physicians have to ask and some clarity before even physicians are comfortable suggesting and requesting participation in taking the vaccine. I don't know if that helped, but hopefully it did.
It does, yeah. So you know what? So don't move because we're going to wrap up in a minute. So I'm back. So listen, I just want to thank all of you because this has been really informative, and just give each of you a chance to make some closing remarks, and then we're going to turn it over to Renee to actually close us out. So let's start with Joyce. Was there any final comment you wanted to make? You got to unmute. There you go.
Yes. I just want to thank you guys, everyone, the superintendent, the whole Cincinnati Public Schools, the staff, the teachers, everybody. Just like I stated earlier, it was an adjustment for everyone, but the adjustment has been going smoothly so far. So I just want to thank everyone, and I want to thank Tropicana for inviting me on here, and everyone just stay safe.
Well, it was great hearing from you because you, you know, you represent parents, and so it was good to hear the questions that parents had. Shauna, you are fantastic. You know, I just, you know, love hearing how prepared CPS is. The fact that, you know, the computers went out to our children, and you guys worked with Children's Hospital and Cincinnati Bell to get internet, even for those who couldn't afford it. I mean, we're going to come out of this better than where we started. You know, we know that we have to kick it up a notch in terms of technology and internet. And so that's so important. And we really appreciate that. And this studyhall.org, I'm going to check that out for us. I mean, that's going to be great for calculus, and people can volunteer. So parents and, you know, community members, anyone looking to help our children, you can sign up to tutor at studyhall.org. We're going to get Tropicana to be our new Michelle Obama, and she's going to start reading to our children. And everybody out there, if you are not connected with CPS, they don't know where you are, where your children are, please call 513-363-0000, 363-0000. We need to know where your children are. Are they in school? What can we do to get them in school? We don't want anybody out there just not accounted for. So thank you for that. So Shauna, let me give you a chance to make some remarks, and then Tropicana after you.
Well, first of all, certainly Jan Michelle, Renee, Tropicana, Joyce, thank you for the opportunity to hear from Cincinnati Public Schools. I better be sure to plug this board meeting Monday at 5 o'clock. Following the board meeting, that decision, the district is hosting parent town hall meetings. virtual parent town hall meetings on Tuesday, Wednesday, and Thursday. Please check our website for those times. Also, right now, closing tomorrow, Sunday, is our parent thought exchange. So we want to hear from parents. We want to be supportive of our parents. You're so important to us. That also is on our website, Cincinnati, cps-k12.org. Thank you.
Thank you so much. Okay, Tropicana.
In closing, Joyce, thank you so much for joining. Keep posting, girl, so I can keep stalking and learning new things about being a parent and a mommy. Michelle Lemon Kearney, thank you as always for just being such a classy council member and caring about the community and setting just an amazing example. Ms. Murphy, thank you for always being so informative. It's always a pleasure to get an opportunity to talk with you. And thank you for being the village that my listeners, my friends, my family need. And I know that we said it professionally, but you know it's still me. So I just need to make sure that I say this. Parents, parents, parents. If you are my listener, you know I'm your friend. If you're not my listener, let me let you know that I am your friend. I'm your sister, your cousin, your homegirl. Your child's educational success starts with you. So there is no excuse for you not to have your child logged in for school. For CPS to say that there could be upwards of 3,000 to 5,000 students who have not logged in is unacceptable. It's unacceptable. If you have a phone, if you have social media, if you have a job, it's unacceptable for you to put your child in a position to not be able to succeed. As parents, our job is to make sure that our kids have the best life, to be better versions of ourselves, to be educated, to have a chance. And if you as a parent have not enrolled your child, shame on you. Now, also as a parent, I'm gonna say this, as a mom, and especially as a new mom, I don't know if I still kind of qualify as a new mom because we 4 years in now, we've survived each other, so I'm almost a pro. I want to tell you this, I understand how intimidating that is. I get how scary it is. Maybe not have resources you need to have the money to pay the internet bill. Maybe you did not finish school and it intimidates you to have to be able to be an assistant with your child. Maybe you don't get it. That's also not an excuse. I empathize with you, but it's not an excuse because CPS has amazing resources. My baby is not even in CPS yet. He's in preschool. But CPS-K12.org has an amazing source of resources, from after school programs at the CRC. I didn't even know they did that. You don't have to do it by yourself. The CRC has classes. They have free internet. They also can talk to you about computers, and there are a plethora of teachers and administration who want your child to succeed, because if your child wins, they win. And if your child and your school is winning, you as a parent win. There's no excuse for your baby not to be in school. 300 kids, I can see. 3,000 to 5,000, you out of control, you wrong. If you made it to the club, or you made it to the party, or you made it to work and your child didn't make it to school, you're wrong. And you need to do better. And I'm saying that with love, a hard message with love. Do better. Our babies have to be better than us. Take care of your responsibility. And thank you so much for sharing those sources with us. Thank you, Ms. Shauna. Thank you, Jan Michelle and McKerney. Sorry, y'all, I'm off my platform.
Tropicana, you're awesome. Okay. So, and here is Renee Mahaffey Harris, another awesome woman and leader in our community.
Well, I'm just going to wrap it up, but I want to thank our collaborators in making this COVID site available and the town halls available. The African American Chamber of Commerce, Eric Kearney, President. The Urban League of Greater Cincinnati and Southwest Ohio, Eddie Cohen, President and CEO. The NAACP, First Vice President Joe Mallory. Cincinnati Medical Association, Dr. Roosevelt Walker. And the Center for Closing the Health Gap is proud to be powering these conversations. What we've found is communication is our divide. And so I am really grateful to have our collaboration with Radio One, Tropicana, and other radio personalities who are delivering messages on their own personal sites, who are really using their voice to speak to parents of the district. And we've also placed on our COVID-19 communityresources.com site a link to many of the resources that Tropicana just mentioned. And we will be adding what Shauna just shared as well, if I can get that from your team. But what we want to be able to do is make sure that we are a vehicle in getting information out, and also that we will work with other organizations to see how we can fill the gaps for the support needs that are needed for our parents in the school district. So Shauna Murphy, Joyce, Tropicana, and of course, our moderator today, Councilmember Jan Michelle Lynn McCurney. Thank you all for being a part of this conversation. We look forward to rebroadcasting this conversation, as well as continuing to work with CPS to get good messages out that make sure that our students, our parents, and our teachers are supported, and that we connect all the dots collectively as a community. So thank you all. You have a blessed rest of this weekend.
And we'll see you next week, 4 o'clock Saturday.
Jan Michelle Lynn McCurney. Bye,
All
y'all.
right, Tropicana. Woo-hoo.
Bye.
Alabama, yeah. Oh, that's your empty chair.
All right,
Look
so
at
you
that.
just hit, if you hit, you won't be able to leave it. I have to leave it. But we're gonna talk about these processes and make sure there's a test.